One of the earliest articles that I wrote in the early 1970s is the question of the obligations of citizens of wealthy nations like this one to people in other parts of the world who are in extreme poverty or possibly even in a situation of desperate need. If we move forward to today, we could look at the Ebola crisis and look at what that is doing and threatens to do to parts of West Africa. And that's an interesting situation because obviously the media have been full of this situation, but in particular they've been full of the situation affecting the United States and the very small number, a handful of Americans who've contracted the disease and what is to be done about that. Now, certainly that's important. I'm not for a moment saying that it's not. But the fact that the crisis has developed where it has in Liberia and Sierra Leone is really due, in part at least, to our failure to assist those countries to provide better infrastructure in healthcare. And that's what is now coming back to at least threaten us. If you compare the situation in Nigeria, where there were some cases and where for a time it seemed that Ebola could spread even more disastrously because cities like Lagos have so many more people than in Sierra Leone or Liberia, it appears, I know one has to be careful in making categorical statements in a fluid situation, but it appears that a catastrophic outbreak has been averted there because there was a hospital developed and built substantially by aid from this country, primarily, as I understand it, from the Gates Foundation, not specifically to deal with Ebola, but to deal with infectious diseases, deal with polio, and then subsequently to deal with HIV/AIDS. And because there were well-trained staff and good resources, it seems that it's been possible to control that outbreak. We can certainly hope so. And perhaps if we had done more beforehand for the other countries where the outbreak exists, we may not be facing the tragic situation we are now. So that's the present face of that situation, and it is a situation which calls on us, I think, to explicitly endorse a global stance, again, a point of view of the universe stance of global solidarity wherever the disease is, and not to retreat to a kind of fortress U.S.A. attitude where we say we close our borders, we make sure that nobody who is at risk of having the disease gets into the United States, and we worry only about where the disease is threatening us now. That's probably not feasible to do even if we wanted to do it, but I think it would be a profoundly unethical approach to take even if it were feasible.